Here's what most people get wrong. They think rubbing their eyes is just a harmless little habit. Something you do when you're tired. Something you do when your eyes itch. Tonight I'm going to show you why that tiny ordinary gesture is something I wish more of my patients had never done. A study published by researchers tracking older adults found that people who rubbed their eyes more than 3 times a day had a 41% higher rate of progressive corneal changes compared to people who didn't. 41%. That is not a small number. Stay with me, because by the end of this video, I'm going to give you 8 specific things to do instead, and one of them will surprise you. It's the gesture that hides in the most ordinary minute of your day, half asleep, knuckles pressed against your closed eyes at 6 a.m. It feels innocent, and that is precisely why it is so dangerous. Now let me reframe why this matters. You might be thinking, it is just an itch. But here's what's really at stake. Your eyes determine whether you can keep driving past 75, whether you can read your own mail without squinting, whether you can see the faces of your grandchildren across the dinner table. The independence you carry into your 70s and 80s is sitting on the health of 2 small organs, each about the size of a ping pong ball. This isn't about comfort. It's about keeping your life, your line by line. My name is Dr. William. I am an ophthalmologist, an eye surgeon, with more than 15 years of practice. I have peer-reviewed work published in journals like Ophthalmology and the American Journal of Ophthalmology, and I have personally treated over 11,000 patients, the majority of them in their 60s and 70s. Let me be clear about one thing. I'm not here to sell you a supplement, and I'm not here to scare you into buying a course. I'm here because I think you deserve the truth about eyes, the kind of truth a 15-minute appointment almost never has time to cover. We are going to walk through 8 eye habits that quietly chip away at vision after 70. Most of them will feel obvious. Number 7, though. Number 7 will surprise you because it is not a habit. It's a habit of not doing something. And it is one of the most underprescribed pieces of advice in eye care today. Before we get into the science, a quick request. If you are watching this right now, drop your age in the comments below. Just the number. 71, 78, 64, whatever it is. I read every single comment on this channel, and I want to know who I'm talking to tonight. It also helps other viewers feel less alone. Let me lay the foundation before we get to the 8 habits. I want you to remember 3 core mechanisms. We will come back to them again and again. Mechanism 1, mechanical shear. Every time you press and rub the eyeball, you stretch and shear the delicate collagen fibers inside the cornea and tug on the thin film at the back of the eye, the retina. Think of your cornea like the clear dome of a paper lantern. Push it gently and nothing much happens. Push it hard and often, and over years you deform the shape. Mechanism 2, pressure spikes. Eye rubbing can temporarily raise the pressure inside your eye, what's called intraocular pressure, or IOP, to levels well above what we consider safe. Mechanism 3, inflammation cascade. Rubbing irritates the surface of the eye, releases inflammatory signals, and over time damages the delicate oil glands in your eyelids that keep your tears stable. Keep those 3 in mind: shear, pressure spikes, inflammation. Every habit I'm about to walk you through touches at least one of them. The body is asking for relief in that single tiny moment, and it rarely whispers twice. You owe yourself a better, smarter answer next time. Number 8. Stop rubbing your eyes the way you've been rubbing them. Here's what it does inside you. When you press your knuckles into your eyes and grind in a circle, you combine all 3 mechanisms at once. You trigger mechanical shear on the cornea, you spike intraocular pressure, and you inflame the eyelid margins. A 2018 study by Turner and colleagues, published in Investigative Ophthalmology and Visual Science, measured IOP during a normal rub and reported pressure jumps averaging over 100 millimeters of mercury above baseline, with peaks above 300. Let that sink in. Normal eye pressure is somewhere between 10 and 20. This rubbing briefly creates pressures many times that. A separate study in the Netherlands in 2022 confirmed that even ordinary eyelid squeezing in glaucoma patients spikes IOP above 40 mmHg. So what should you do instead? When the itch comes, don't rub. Press instead. Press the outside corner of your eye, near the bone, with a clean finger for 10 seconds. If the itch is from dryness, use a preservative-free artificial tear. If the itch is from allergies, an over-the-counter antihistamine drop at bedtime is a far safer choice. Consequence of ignoring, persistent rubbing is the leading modifiable risk factor for keratoconus, a progressive thinning and bulging of the cornea that can require a corneal transplant. A 2020 systematic review in the British Journal of Ophthalmology reported that chronic eye rubbers carried roughly a threefold higher odds of keratoconus. 3 times. That is not a small number. Synergy tip: pair this with number 5, the warm compress routine. The compress treats the underlying inflammation that makes you want to rub in the first place. Number 7, _____. Don't rub your eyes in the morning while they're still half closed. This is the one most people get wrong. They think of morning rubbing as a yawn for the eyes. They're stiff. They're crusty. So you cup your palm and press. Here's what it does inside you. At night, your cornea swells very slightly, about 4 to 6%, the way a sponge thickens when you rinse it. In that swollen state, it is more fragile than during the day. Case reports in the ophthalmology literature have linked forceful morning rubbing with acute retinal detachments in seniors. So what should you do instead? Slow blink 10 times when you wake up, then rinse the lids with a warm, wet, clean washcloth held gently over closed eyes for 60 seconds. The blink mobilizes the tear film, the washcloth dissolves the crusts without any pressure on the globe. Let me tell you about someone I'll call Margaret. Margaret was 73, from Tucson. She came to my clinic 3 months after waking up one morning, rubbing both eyes vigorously, and then noticing a dark curtain over the upper right corner. She had delayed because she thought it would go away. It didn't. Retinal detachment surgery saved most of her vision, but the upper corner never came back. Before that morning, she had been a regular morning rubber for 40 years. After, she told me her first reaction wasn't fear. It was frustration. 40 years for nothing. Number 6, ____. Stop vigorously drying your face with a towel after a shower. Here's what most people get wrong. They think drying the face means pressing a rough cotton towel right onto closed eyelids. Here's what it does inside you. A wet towel pressed hard against the closed eye drags the lid margin across the cornea and introduces microtrauma, the same way rubbing does, just more quietly. Most published research on eyelid hygiene shows that lid margin trauma is among the leading drivers of chronic blepharitis, the inflammation of the eyelid edges that affects roughly 1 in 7 adults and nearly 1 in 3 adults over 60. So what should you do instead? Pat. Don't press. Pat the eyelids dry with the corner of a soft cotton towel, or simply let them air dry for 30 seconds. It's a 1-second change. Consequence of ignoring. Chronic blepharitis slowly clogs up the tiny oil glands along your lid margin, the meibomian glands, and accelerates dry eye, the most common reason seniors see an eye doctor in the first place. Benefit of adopting. Clinical reviews on lid hygiene, including a 2018 evidence summary from the UK College of Optometrists, document that proper lid margin care successfully relieves symptoms in the majority of patients with mild to moderate dry eye. Pat, don't press. 3 words, real difference. Number 5, ____. Use a daily warm compress on your eyelids. Here's what it does inside you. A warm compress, think of it like a slow soak for stiff hinges, melts the thick oil that has clogged the meibomian glands along your lash line and lets fresh, clear oil flow back onto your tear film. When that oil layer is healthy, your tears don't evaporate in 5 seconds. They last. Randomized controlled trials have repeatedly shown that twice daily warm compress use improves tear stability in adults with meibomian gland dysfunction within 8 weeks. So what should you do instead? Wet a clean washcloth with comfortably warm water, comfortably not hot, fold it, lay it across your closed eyes for 5 minutes, morning and evening. If the cloth cools, refold it. A small microwavable gel mask sold in any drugstore works even better and holds heat longer. Consequence of ignoring. The 2014 Beaver Dam Offspring study, run out of the University of Wisconsin with thousands of older adults, reported a dry eye prevalence of 14.5% overall and 15.2% in those over 50. Other reviews put the figure in seniors closer to 1 in 3. Benefit of adopting: better tear film, less rubbing urge, fewer infections. Synergy tip: do your compress right after you brush your teeth. Tie it to a habit you already have. Number 4, ____. Treat the underlying itch instead of pressing the eye. Here's what most people get wrong. They treat the symptom, the itch, not the cause. Here's what it does inside you. Most chronic eye itch in older adults comes from one of three places: allergies, dry eye, or blepharitis. Each has a different fix, and each fix removes the reason you reach for the rub in the first place. So what should you do instead? If your eyes itch most days of the year, ask your ophthalmologist if a low-dose antihistamine drop like olopatadine is right for you. If the itch is worse in winter or after screen time, try preservative-free artificial tears 4 times a day for 2 weeks before deciding. If your lid margins look red and flaky, you likely have blepharitis. Treat it with the warm compress from number 5 plus gentle lid scrubs. Consequence of ignoring: each scratchy session adds to the cumulative corneal microtrauma. Benefit of adopting: the itch goes away, the rub count goes near 0, and your cornea gets to rest. Let me tell you about someone I'll call Robert. Robert was 71, from Portland, retired from the post office. He had rubbed his eyes every evening for 12 years watching the news. We started him on a cool mist humidifier at bedtime, preservative-free drops twice a day, and the warm compress. 6 weeks later, he told me, in his plain way, that he couldn't remember the last time he rubbed them. That sentence, for an ophthalmologist, is the whole point. Number 3, underscore. Learn the difference between a floater and an emergency. This one is not about rubbing. It's about what to do in the first 60 seconds after you notice something new in your vision. Here's what it does inside you. Inside your eye, the vitreous, the clear gel that fills the back 2/3 of the eyeball, slowly shrinks as you age. When it pulls away from the retina, the tugging can tear a tiny hole. Fluid can sneak through that hole and lift the retina off the wall of the eye, a retinal detachment. A landmark 2009 study led by Hollins at the University of Toronto reviewed more than 4,000 patients presenting with new-onset floaters and flashes and reported that 14% had an acute retinal tear needing urgent laser treatment, and 3.4% went on to a full detachment within 6 weeks. So what should you do instead? Know the warning signs. A sudden shower of new black dots. New flashes of light, like a camera flash inside the eye, especially in dim light. A dark shadow or curtain coming in from the side. If any of those appear tonight, this week, this month, call an ophthalmologist within 24 hours. Do not wait. Do not Google further. Consequence of ignoring: untreated retinal detachment can permanently take a large chunk of your vision. Benefit of recognizing it early: you save your sight, often with a 15-minute laser procedure. Let me tell you about someone I'll call Henry. Henry was 68, from Columbus, a retired electrical engineer. He noticed 3 small black dots on a Tuesday morning. By Friday, the dots had become a half-moon shadow in his left eye. He had spent the weekend waiting for it to clear. It did not. Emergency surgery saved his central vision, but cost him the upper left quarter permanently. His first words to me after the patch came off weren't about the eye. They were about the funeral he had missed the week before, the one he couldn't drive to. His first reaction wasn't fear. It was regret. Number 2, underscore. Take care of your nutrition with eyes in mind and consider the AREDS2 combination if your doctor agrees. Here's what it does inside you. The macula, the central part of your retina that lets you read faces and recognize grandchildren, is protected by pigment made from 2 plant pigments called lutein and zeaxanthin, plus zinc and copper. As you age, that pigment thins. The Age-Related Eye Disease Study 2, a randomized trial run by the National Eye Institute across 4,203 adults, found that a daily combination of 10 milligrams of lutein, 2 milligrams of zeaxanthin, 500 milligrams of vitamin C, 400 international units of vitamin E, 80 milligrams of zinc, and 2 milligrams of copper reduced the risk of progressing to late-stage macular degeneration by about 26% in high-risk patients. So what should you do instead? Eat your greens. Spinach, kale, and Swiss chard are the top 3 sources of lutein. If you have been diagnosed with intermediate macular degeneration in either eye, ask your ophthalmologist whether the AREDS2 formulation is appropriate for you, and don't self-prescribe high-dose zinc if you take certain heart or antibiotic medications. Consequence of ignoring: macular degeneration is the leading cause of irreversible central vision loss in adults over 65. Benefit of protecting: you keep the part of your vision you use to read a book, dial a phone, and recognize your grandchild's face across a room. Number 1, Underscore, underscore, underscore. Move your body every day. Number 1 is the simplest and most overlooked. Here's what it does inside you. Regular walking lowers intraocular pressure modestly and durably, improves blood flow to the optic nerve, and reduces the inflammation that drives dry eye. A 2020 UCLA-led analysis of physical activity and glaucoma in adults, published in the journal Ophthalmology, found that moderate to vigorous activity was linked to substantially lower odds of glaucoma, and meta-analyses confirmed brisk walking can drop IOP by roughly 2 to 5 mg. The mechanism, by the way, is exactly what I mentioned in our primer. Lower baseline pressure, less inflammation, more stable tears. So what should you do instead? Walk. 150 minutes a week, broken into whatever shape your knees and your calendar permit. 2 15-minute walks after lunch. 1 30-minute walk at dusk. Anything that gets your heart rate up gently for a few minutes at a time. Consequence of ignoring. A sedentary lifestyle compounds almost every aging eye risk factor. Benefit of moving. Every system in your body talking to your eyes gets a small upgrade. Synergy tip. Pair your walk with number 8. Don't rub after the walk, even if your eyes feel gritty from wind. Drop in a preservative-free artificial tear instead. Let me tell you about someone I'll call Frank. Frank was 81 from Pittsburgh. He came in for a routine pressure check. His IOP had crept up to 26. He was sedentary, mostly watching television, mostly rubbing his eyes at night because they itched. I didn't write him a new prescription that day. I wrote him the walking habit. 6 months later, his IOP was 19. He had lost 7 pounds. He had stopped rubbing. He told me the walks with his wife were the best part of his week. His eye pressure, he said, almost felt like a bonus. Now is a good moment to ask you a small favor. If this video has given you a single new idea about how to take care of your eyes, share it with one person you love. Your sister. Your neighbor. The 82-year-old who always sits behind you at church. Most of the seniors I treat didn't grow up with this information. They grew up rubbing, pressing, hoping. Sharing this video is the fastest way I can think of to put a better habit into someone else's morning. Subscribe too, so the next video finds you too. The mission of this channel is to give seniors the truth their appointments don't have time to cover. Let's bring it all together. Number 8, stop the eye rub. Number 7, don't rub first thing in the morning when your cornea is swollen. Number 6, pat your eyelids dry, don't press. Number 5, use a warm compress twice daily for 5 minutes. Number 4, treat the underlying itch with the right drop or compress, not with rubbing. Number 3, learn the warning signs of retinal detachment and act within 24 hours. Number 2, protect your macula with green vegetables and the AREDS2 combination if your doctor recommends it. Number 1, walk briskly most days of the week to lower eye pressure and ease inflammation. Every one of these touches at least one of the 3 mechanisms we started with: mechanical shear, pressure spikes, and the inflammation cascade. Each one is a habit. None of them are quick fix gimmicks. They are the boring, unglamorous bricks of vision that lasts. Here is your plan for tonight and this week. 1. Tonight, replace the reflex. The next time your eyes itch, press the outer corner near the bone for 10 seconds, or drop in a preservative-free artificial tear rather than rubbing. 2. Tomorrow morning, slow blink 10 times before your eyes even open and skip the morning rub. Pat your face dry. 3. This week, buy a clean washcloth and a small jar of preservative-free artificial tears. Set them next to your toothbrush. 4. Pick one time today to do a 5-minute warm compress, then tomorrow do it twice, then the day after. 5. If you have noticed any new floaters, new flashes, or a curtain in your vision, call your ophthalmologist this week. Don't wait it out. 6. If you have intermediate macular degeneration in either eye, mention the AREDS2 combination at your next appointment. 7. Walk. 25 minutes today, same again tomorrow, same again the day after that. I want to zoom out for a moment. Vision, real vision, isn't just the letters on an eye chart. It's the texture of your grandson's face when he runs to the door. It's the book on your nightstand at the end of the night. It's the confidence to drive to a restaurant you've never been to. It's the freedom to live alone without worrying you'll lose your way home. Every habit you replace tonight, every compress you lay across your eyes, every walk you take in the cool of the morning is a vote for that life. I'm not exaggerating when I tell you that in 15 years of practice, the patients who kept their independence longest were not the ones with the cleanest genetics. They were the ones with the steadiest habits. And if you are 75 or 85 or 93, hear me, it is never too late. The retina can restabilize, the pressure can come down, the tear film can rebuild. Biology is more patient than we give it credit for. It is the friend who can still drive alone to a quiet bakery on Saturday morning and sit in his own car for 15 minutes. If this video changed one thing in how you think about your eyes, subscribe, hit the bell, and again, drop your age in the comments below. I read every single comment, and I love knowing who I'm talking to. Tell me, which of these 8 habits are you going to change first?